Thanks, Kieran, for your very enthusiastic presentation around some of the background and history to our debate and discussion this evening. I'd like now to warmly introduce Dr. Tuk Meng Soo, who's very shy in his demeanour, but certainly has a wealth of knowledge to share and depart with us. As a brief introduction, come from England and migrated to Canberra in 1989. He has worked as a general practitioner at the Interchange General Practice since 1996, where he started managing patients with HIV infection. This remains one of his key areas of work, where he certainly works nationally and internationally with fellow colleagues. So please warmly welcome Dr. Soo.
Thank you for the introduction. PrEP. So, I think that the reason why PrEP's come up is partly because it's now been recommended by the CDC in the USA, but partly also there's a bit of concern about the fact that we've really been seeing increasing HIV notifications in Canberra the last 3 years, and there's some evidence to say that those increased notifications aren't just the fact that we are picking up more people, that there are actually more infections actually happening. And as Kieran mentioned, a significant proportion of those diagnosed remain men who have sex with men. So how are we going to deal with that? I guess our first response in Interchange General Practice, which we started earlier this year, was actually to introduce rapid testing, because there's some thought out there that a lot transmission may be happening by people who aren't actually aware that they're HIV positive, and that if we can actually reduce some of the barriers to testing, that may allow more people to be aware of their status and take precautions to stop transmitting their infection. So we introduced that in the Interchange General Practice in January this year. We haven't actually done a huge number of tests. We've done about 24 I think now so far. And we haven't actually had a single positive rapid test yet. So obviously that particular landscape will probably change sometime next year, because when the new government actually came into power, the health minister announced that he would actually allow the introduction of the oral quick test, which is the rapid test that doesn't rely on well, it can use blood, but it can also use saliva, so it's potentially easier for people to use. And we're yet to see how, well, we're waiting for the TGA to license it, and we're waiting to see how the TGA will license it. Whether it will still have to be administered by a health professional, as with the current rapid test, or whether you can actually buy it from 7-Eleven, like I gather they do in the States. So PrEP. Now, as Kieran has already helpfully mentioned, the reason why PrEP is now talked about is because there have been a few studies that have suggested that if people are going through PrEP and they actually take it relatively regularly, like at least 4 tablets a week, then you actually get a reasonably good efficacy in terms of preventing the transmission of HIV. Given in the context that there seem to be an increasing number of infections in Canberra, there may be some benefit in introducing more models, that or more tools that people can use, in terms of actually reducing transmission. So it's not just use a condom. There may be other methods that people can use. Some of the issues around, and as Kieran also mentioned, there are actually other possibilities down the line, and I'll sort of run briefly through some of those. But at the moment, practically speaking, the main option in terms of PrEP is really oral Truvada. There's the potential cost of the PrEP, because it's not actually funded by the PBS. Philip, do you actually mention how much it would actually cost if you actually bought Truvada here?
$1,000 a month.
That's the cost, I think, if you actually buy it from India.
It's $800 a month.
$800 a month, is it right? Okay, yeah. I got it wrong. Yeah, so it's about a tenth of that if you actually buy it from India.
That's right.
Yeah.
And about an eighth of that if you buy it from Singapore.
Right, okay. Yeah. Thanks, Sarah. Practically speaking, for most, so the situation is that it's not actually a license for PrEP, and I haven't tried doing it, but I suspect that if I actually wrote a private script for one of you, you can probably go to a pharmacy and they can probably supply you with Truvada, but that would be at a cost of about $1,000 a month, I could actually do supply a script, and we can probably help you to import it from India or Singapore at a fraction of that cost, and it's actually legal to do that. But because it's actually not licensed as PrEP, now if I would actually do that, I can't actually advertise that I'm providing PrEP. Because it's not actually licensed for that purpose in Australia. And if I did if I did actually advertise that I was actually providing PrEP, I could potentially be sued, and if somebody actually got infected, they could actually say, you provided me the wrong advice. And I think the other issue that we've all talked about a little bit about PrEP is that the idea is, in professional terms, they talk about risk compensation, and Kieran has also touched on, that's the jargon term for saying, okay, if we actually provide people with tablets which we think will stop them from getting HIV, would they therefore stop using condoms and indulge and actually participate, in riskier sexual activities? As Kieran mentioned, the studies so far looking at PrEP suggest that that's not the case, but it's hard to think, that's not going to happen. I think the fact that there have been an increasing rate of STI infections in Australia, particularly among MSM, suggests that people actually don't really like using condoms if they can actually avoid using condoms. So if they actually I would have thought that if I actually provide people with a means by which they think they can avoid getting HIV infection without using condoms, then they're probably not going to do that. On the other hand, providing PrEP may mean that a patient will actually have to have regular contact with their doctor. That may mean that I have an opportunity to actually make sure they actually get their STI test done fairly regularly. Probably more regularly than a lot of people are having been done now. And one example of that, I think, is the fact that I also do a lot of work in the drug dependency area. So, I write a lot of methadone and buprenorphine scripts, and I also got a lot of patients with benzodiazepidency. And the result of that, is that we actually see these patients really regularly. Usually at least every 3 months with a methadone script, and more usually every month or so, which means that for this group of people who are generally very marginalized, I've been able to develop an ongoing relationship with them, and I've been able to make sure that they actually get their regular blood tests for hepatitis C and other things that actually have an impact on their health. So I think that while I think so with the issue of risk compensation with PrEP, it's still a little bit unclear. But I think that the benefit of providing PrEP could be that we actually make sure that everyone gets their STI test done. Now, which model of PrEP are we going to use? Kieran mentioned, he alluded to several studies in his slide, and I think the one that actually caught everyone's attention was a study that was called IPREX, where PrEP was actually provided to people on a daily basis. So people actually given medication, asked to take the medication every day to actually stop them from getting infected HIV, and they actually picked people who they regarded a fairly high risk of infection HIV, based on things like their sexual history, their reported sexual practices, history of STI infections, and so on. And what they found was that not everybody took. Obviously, not everyone took their tablets every day, but as Kieran alluded to, the study suggested that if people took their tablets roughly about 4 days out of every 7, then they actually got quite high level protection. Not complete protection, but quite high level protection. Now, would people be interested in taking a tablet every day for disease that actually don't have well, I've read an article somewhere, it may even happened by Nick, where he may say, well, women take the pill every day to prevent an infection called pregnancy. So why wouldn't gay men take a pill every day to prevent an infection called HIV? The alternative model is actually a study that's been conducted in France and Canada at the moment called IPERGAY, where they actually provide enough medication for the participants in this study to actually take a tablet every day, but they've actually been suggesting that people take it for intermittent periods of time around sexual activity. And the recommended model in IPERGAY is for people to take 2 tablets of Truvada at least 2 hours and not more than 24 hours before when they think they like their sexual activity, and then continue to take 1 tablet a day during the period where they're going to have sexual activity, and to take a tablet 24 hours, and to finish off with 1 tablet 24 hours after the last sexual activity. So you can think of like a Friday to Monday regimen for your dirty weekend. So so I haven't I've had discussions with Philip, my HIV nurse, about what we're actually going to do about PrEP in the Interchange General Practice, and I'm actually reasonably open to what people want to do. So if somebody comes to me to say, look, I have unprotected sex, and I don't want to get HIV if I can help it, and I prefer the IPREX model, and I would like to do a script and help me to import this medication from India, and I'm going to take this medication every day. I think fine, that's your choice. Now if you prefer to sort of just come to see us every Friday and get a pack of 6 tablets to last you for the weekend, and we charge you $12 or whatever for it, that's fine too. It's your choice. So and some of my patients tell me that PrEP is already being used to facilitate unprotected sex. So I've had a patient the other day say that, and I can't remember the name of the site he mentioned, but he said that on this particular site they come across a couple of people who advertised the fact that they are on PrEP. And he said, well, obviously they're looking for somebody to have unprotected sex with them, otherwise why would they mention that? And I think that I've had at least another patient who said that he's actually come across ads specifying that. So it's already been used for that purpose. So so I think that I'm just interested in offering another option to the MSM community in Canberra. And I'm happy to have your feedback about what you think would work. Okay, thank you.